Recording in progress.
Welcome everybody to the August 21st Health and Human Services Committee meeting. Let's see, I heard from a bunch of people at the last minute asking for some changes in the agenda. That's all good, we can accommodate everybody. I heard from Cindy Wilcox from Human Services Coalition, she'll not be here today. So let me propose these changes to the agenda. We're going to put Veteran Services on, J.R. Claiborne, at number 6 1/4 on the agenda, and Youth Services, number 6 1/2 on the agenda. Is that okay with everybody? We have 4 members of the committee present, and we have our 5th member who will be joining us by Zoom. Looks like he's not here yet, but will be. So, okay. Any other changes to the agenda before we dive in? Okay, any public comment?
None that I know of, but I do see that I have 2 members of the public on here, AJ and Christian Moylan.
So
Are you aware?
AJ's coming for a specific agenda item.
Kristen, she's also on the table.
Okay, they're going to join us at the, well, I mean, they're free to speak now if they want, but they're going to join us when we get to the opioid task force agenda item.
Okay, we'll wait to promote them then.
Yeah, and then they can say whatever they want.
No further public comment.
Great, thank you. All right. County Administrator's report.
Thank you, Dan.
Hi, Lisa.
Hi. I don't have too many updates. The one thing I did want to mention to this committee is that it's been a week since we implemented the enhanced security measures at the Human Services Building. That includes the weapons detection screening and an armed security officer. And I would say that it's been relatively smooth. We have had to make some adjustments along the way, and we're still learning as we go, but it's, most of the way implemented, working smoothly. We are planning to meet in a week's time to further assess the process and see if there are any improvements to be made. But it's been a step that's been long in coming. So I think that's all I have for this committee this week. We're still very much working on the budget, the 2024 budget for the September deadline.
Any questions for Lisa? Thank you. Then next up is number 6, Department of Social Services, Kit Kephart. Hello, Kit.
Hi, everybody. So we have two resolutions. That's where you were going, Dan, right? Is the resolutions?
Resolutions, and then if there's anything else you wanted to say. Sure.
So we have 2 resolutions on the table. Both of them are budget adjustments. The first one, 11883, really has to do with our 6010 program. This is really consolidating most of the federal and state revenues in our 6010 program into one administrative line each. The state just recently provided a new tool that will account for these in this new way, and so our 2024 budget also records them in this way. So there's no change in amount of revenue, no change in net local cost. It's just really a change in format and how we're tracking these.
Great, thank you. Is there somebody that would like to move it, put it on the table? Randy? Amanda seconds, thank you. Discussion, Amanda.
Thanks, just more of like a formatting question. Sometimes I just wonder like if it should say like from this to this, because it's just kind of a list of numbers. I don't know.
So in this case, yeah, so we could definitely try to look at how to change that. Trying to see with the other resolution.
Yeah, I mean, the next one is similar. It just sort of lists decrease and increase, and, you know, the numbers add up, and it's, you know, but it just, for somebody who doesn't know how to read this, or, I don't know, it's just a little bit unclear in my mind, but maybe.
Sure.
Yeah. But
Sure. So we can explore that. I can try to figure out how we could do that differently.
Yeah, I'm not sure what to say. If you want to, would finance be helpful to talk to too, or is that not really in their budget office?
I don't know. I mean, it might be more of like the clerks, like how to, because I feel like there was one time not that long ago that we just added in that something was going from this to this. Do you know what I mean? Like,
I'm not sure I do, to be honest. I'm sorry. I think Lisa maybe has something to
Well,
say.
I do think that all of the budget adjustments and transfers go through the finance department, and often, so we're aligning with what they need in terms of account numbers, which doesn't always necessarily make the most sense to me reading it,
Yeah,
but
right.
it makes the most sense to them for the accounting purposes. So it would probably be good to connect
Okay.
with them and see what might make
if
most
there's
sense.
something that could just be a little bit more clear. Okay. All right. Thanks.
Thank you. Any other discussion on the resolution? Are we ready to vote then? Okay, we'll do a roll call vote. Amanda?
Yes.
Randy?
Yes.
Susan?
Yes.
I'm a yes, and is our fifth member? I don't see our fifth member here. So, okay, so that's unanimous. Thank you. Okay, well, how about we put the next one on the table? Resolution, budget adjustment, social services ID 11790. Somebody move that? Amanda moves. Randy seconds. Thank you. Okay, Kit.
So this one, very similar, and we can look at format here. This is really moving money between several different mandate programs. We've seen an increase in some of our mandate programs and decreases in other areas. So without going through every single one, the sequence of events of moving this will be local cost neutral. There's no change there. So it's really just moving things around to kind of accommodate what the needs are presently. We've seen a decrease, for instance, in our Medicaid expenses and an increase in our safety net expenses. So there's adjustments in each one, in each area, but we're just moving things around to be able to manage that. So.
Great, thank you. Any questions or comments? All right, ready to vote then? Amanda?
Yes.
Randy?
Yes.
Susan? So
Yes.
I'm a yes. I was just checking because we have a fifth member that may be joining us. So no, we're unanimous. Very good, thank you. Anything else for us, Kit?
I don't have anything else. We are busy. There's a lot going on, and we are all working, but I don't really have anything else. Lisa gave the update about the security system, and we've been working hard on kind of making those small adjustments that she had talked about. So other than that, I don't really have another update, but thanks.
Well, thank you. And I know you have other things to attend to today, so good luck with that.
Thank you.
You're welcome. Okay, and then next up is J.R. Claiborne from Veteran Services.
All right. Good afternoon, everybody.
Good afternoon, J.R.
All right, there we go. Get us in focus. All right, thank you. I just wanted to be able to introduce part of my updates here. Sitting right beside me, most importantly, is Michelle Baker. She is a veteran of the U.S. Army and also one who was deployed during Operation Enduring Freedom in Kuwait. And she's just jumped straight in, but I'd like to give her a chance to introduce herself a little more.
Good afternoon, everyone. I'm just really glad to be working in veteran services. It's like giving back to the community. I served, and now I can continue to serve our veterans. So I'm really happy about that.
Well, welcome aboard, Michelle. Is today literally your first day?
No, not today.
Okay.
It was
Almost a month.
almost a month.
Oh, okay.
Yes.
Oh, then you're,
Yes, almost a month, and she has jumped right in. Just been trying to get her onboarded as well as up to speed with everything that's happening here. One of the things that she's been helping me with is I've given her the program we have of Fresh Connect checks, which is similar to the farmers markets coupons that Officer of the Aging COFA does, but they have different ones for veterans, and she's taken that over completely. And one of the highlights of that was just this weekend, she was with me at a National Guard. They just had their turnout after their active duty training. And so we're able to make a presentation of them, including the Fresh Connect checks, which some of them took on. And also Michelle will be attending 2 outreach events with me this week at Cornell. So getting her introduced to people around and just showing her a little bit more of what it is that we do as a department. And I just want to add 2 other things that we have. I'm honored to have been part of the celebration for Gus Day. I know Mike Ziegler brought the proclamation, and he's talked to the legislature about that. But I actually had the honor to help with organizing, help pull together a regional honor guard for Gus. And he had probably about 100 people who were there out at Myers Park to come and say happy birthday to him. It's 100 years, you know, I think as Mike said before, it's like 100 years of Lansing and Tompkins County history just with him sitting there and everybody around him and all the generations. So it's really a great honor to be a part of that. And then 2 other things. One is that starting next month, we'll be honored to have been part of something that's been 3 years in the making. This is going to be a Cornell Law Veterans Clinic / Practicum. This is something that we're doing in cooperation with Cornell Law School as well as Law New York. This is where we're going to be able to, it's a pilot program right now, but Cornell and Law New York are going to work together to try and take on some cases for veterans, some dealing with discharge upgrades, also being able to have just kind of a veterans drop-in clinic where they can come in and ask legal questions. So basically trying to have a legal resource for our veterans community. So I say it's been 3 years in the making because I came here asking about how can we get something like this started. I got connected with someone at Cornell who had the same question. Then COVID jumped in the middle and stopped everything. And then we got it going back again and brought Law New York in. And so it's actually about to take flight. So I'm very happy about that. And then lastly, I just want to make a note about just our, things that we have here in the building. Now, twice now, I've had a chance to help a veteran who needed to make a virtual appearance with the VA for different reasons. And this has really been good to be able to be a resource for our veterans in this way. Really just to be able to open a room up, turn on the camera, get everything set up so that all the veteran has to do is come in and sit down and answer questions and be part of that conversation. It's really shown itself to be a true resource that this department can offer to the county. So I just want to acknowledge that and say thank you.
good, thank you. Are there questions or comments for JR? Michelle, what is your job title?
I'm a information aide.
Is that how you introduce yourself? I'm just trying to, how do I refer to you?
Oh, I'm an information aide, and you
Okay.
can always say Michelle.
Okay. Very good. Okay, well, thank you so much. And I know that one or both of you has another thing to go to too, so you're going to be leaving early as well. Thank you for coming, and see you next time.
Thank you very much.
All right. Next up is Kate Shanks Booth from County Youth Services.
Hi, everyone. How y'all doing?
Good. How are you?
I'm doing okay. Thanks for moving us up, Dan. So we have a resolution. We're seeking approval for a budget adjustment for some state aid that our department gets from the New York State Office of Family and Children's Services for youth development, runaway and homeless youth programming. That amount of that is $44,494. We anticipate this funding every year through our annual budget process, but don't actually get the actual dollar numbers from Office of Family and Children's until after the close of the state calendar, which means that once we get this adjustment, once we get this allocation, we do a budget adjustment to change the actual dollar amounts and reallocate that into our municipalities, agencies, and into our Department for Planning. And it's something that we do every year. So.
Great, thank you.
That's what this is.
Somebody want to move that resolution? Randy moves, Amanda seconds. Okay, any discussion? Randy?
Yes, thanks, Kate. So is this an additional revenue for this year, or it's what was expected?
It is not additional, it is what is expected, except in the sense that the amounts that we anticipated are a little bit different, simply because we don't get the actual numbers until after the state budget closes. So, but we anticipated to get these funds. So.
Thank you.
Yeah.
Any other discussion? All right, then, let us have a vote. Susan?
Yes.
Randy?
Yes.
Amanda? Yes. Travis?
Yes.
I'm a yes, that is unanimous. Thank you, everybody. Kate, any other parting words for us?
Just one sort of big announcement we had. We've been talking about the Open Doors program, the Runaway and Homeless Youth program for Family and Children Services. I think over the last couple of years have been trying to get them certified through State Charities Bureau, Department of State, and a bunch of other regulations and red tape to reopen the host home program. We now have a certificate of operation from the state of OCFS to open those. We have 2 families that are submitting applications and are going through the review process. So we hope to have those homes up and operational very, very soon. Just want to thank them and all of everybody who's worked to make that happen. It's been a very long process for us. And I do believe that last week, Key Bank also made a $5,000 donation to Open Doors for the youth. So just a couple of really cool things that's happening on that front.
Excellent, that is good news. I know it was a long time coming.
Yeah.
All right, well, Kate, you also had said that you might need to leave early, so thank you for coming.
Thanks.
See you soon. All right, next up is Department of Whole Health. Let's see, I think we have Brenda with us today. Hello, Brenda.
Hi there, how are you?
Good, how are you doing? So we have 2 resolutions from you. Let's get that first one moved. Resolution authorization to change labor grade, women, infants, and children, program director, and increase hours for WIC program nutritionist. Amanda moves, Susan seconds, thank you. Brenda, is there anything you'd like to say about this one?
Both of these were approved in our new 5-year award from the state. We just went through the RFA process. They're effective October 1 of 23, so it is some changes for staffing and some shifts in work, the recognition of the work for the WIC director.
Great, thank you. Discussion. I'm going to ask the question that I always ask when there's a change of hours. Is this employee, is that something the employee wants?
Yes.
Very good, thank you. Any other discussion? Let's have a vote then. Susan?
Yes.
Randy?
Yes.
Amanda?
Yes.
Travis?
Yes.
I'm a yes, that is unanimous. Thank you, everybody.
Thank you.
Thank you. Okay, this is the big one for today. This is the big attraction. Long time coming. So let's have the resolution moved first, and then we can start talking about it. Is there anybody that would like to move resolution acceptance of recommendations of the opioid task force, authorization to execute contracts, ID 11881? Randy moves. Amanda seconds. Thank you. I think we have one member who wanted to recuse themselves, and if that's true, this would be the moment to do it.
Yeah, that would be me.
Do you want to say a little more, Travis? It's customary to say, I guess, why.
Oh, okay. I work directly with REACH for our LEAD program. They're contracted to provide services. I'm not sure if any of these services will be covered under this contract. So in that case, I think it's appropriate if I recuse myself from the vote.
Very good, thank you. And then when someone recuses themselves, not only don't they vote, but they're really not supposed to participate in the conversation. So that's why you won't hear from Travis for this one. Okay, I'd like to turn it over to Randy Brown then to cue this up and give us some info to know what we're talking about here.
Thank you. Yeah, Travis was the chair through the process, and appreciate that, Travis. This lasted many months. We met every 2 weeks, and some people met every week. There was a subcommittee that focused on things like the survey and then putting out the RFPs and those kinds of things. A lot of questions and backs and forths on that. Zoe Lincoln was the lead on all of that, and I want to appreciate Zoe for keeping us on task and keeping the schedule firm and correct. Other members were A.J. Kircher, Christina Moylan, Phoebe Brown, and then various people from the health department, Frank Krupa, Brenda Crosby, were also in and out on a lot of those meetings. And Shauna Black was also on that committee, so I just wanted to make that known.
Thank you. And some of those people are in our audience today, so welcome to everybody, and thank you for that work.
I think the process went well. We did end up getting 15 applicants, and we scored them. We had a scoring system which Zoe laid out with a lot of input from people on how to score different categories. It was very similar to the community funds that we had, a little more targeted, obviously, because it was this. But I think that went well, and then we went through the scoring and typically started at the top, who had the highest scores, and worked our way down. And the health department made sure that we weren't overlapping with other opioid funds that were being distributed through another process. So make sure we're doing the same thing, which I think that went pretty well. But I wouldn't mind having Zoe and KJ and anybody else that wanted to speak about it. So.
Okay, AJ's got her hand up. AJ, why don't you start us out?
Okay. I just wanted to point out that this conversation's relevant in that today is National Fentanyl Prevention and Awareness Day. And aside from this discussion, I'm not sure that there's anything else happening in our community around that. But this is big, and it's several months in progress. I did want to point out the community survey that we issued to get feedback had nearly 600 people respond. I'm not familiar with community surveys and how often we put them out there and get feedback, but I was very impressed that 600 people were interested enough to give their feedback on that. I feel like we spent the first several months of the committee becoming educated ourselves on what we thought the issues were and having important critical conversations and inviting agencies in to tell us about what they were experiencing and what they saw the largest needs were in the community. We kind of took that information and kind of put it forth into that community survey and got additional feedback. And then we attempted to use that criteria in the scoring of the applications. So we could award about half of what was requested. So we had 8 funded projects and 7 not is what we're recommending in front of you today. But I also just want to point out before anyone else from the committee would like to speak that there were several very important issues that were not addressed or funded through this process. And how we continue that conversation and keep those issues elevated, I think is of a high priority, particularly in light of the fact that we just were issued a recent alert that our overdose numbers are increasing and are at all-time highs. So that's just what I wanted to add to our discussion today. So I'd like to let Zoe or Christina or anyone else who's on the call, if they want to add anything to our process.
Zoe or Christina, you're welcome to chime in or not. It's up to you.
I think AJ did a great job giving a summary. I don't have anything to add at this point.
I think Zoe did a great job of putting all the information you have in front of you today in an organized fashion. Are there any questions on the recommendations in front of the committee?
Get to that in just a moment. Christina, did you want to say anything, or are you good? It's up to you.
I'm good. I was just going to echo what Zoe, I think AJ did a great job of summarizing the process, and also thanks to Zoe for really keeping us on track and on task and getting this done.
Thanks to all of you. There was a lot of community interest in this, and this is a significant amount of money and an unusual opportunity, so thank you all for stepping in and putting all that time and effort in. So, yes, go ahead, Randy.
I'd like to add that Zoe made sure all the meetings were recorded, and I believe even some of them were transcribed in some way. So all that data is there for all those meetings for people to go back and look at. So.
Before we start any further debate, Brenda, is there anything you wanted to add at this point?
No, Zoe really handled this and did a wonderful job. Frank and I are both very appreciative for her taking this on.
Thank you. Okay, committee members, any discussion? Amanda.
Well, I would just add my thanks as well to my colleagues and all of you and everyone who participated. It's great to see money going towards these projects and these organizations. So I don't really have any questions. I guess my only comment was I feel like pages 10 and 12 are the same. Page 10 and 11 or 12 and 13. Are they different, or what am I missing?
Like duplicates.
That's kind of what I thought. Maybe it just got printed twice or something.
Okay, it looks like they're just duplicates. If we find out that there's some subtlety that we're missing, then we'll be informed of that when someone figures it out. Good?
Cool, thanks. And yeah, just thank you for all your work.
Any other questions or comments? I just want to point out, I'm not sure this got said today, and just for the sake of everyone listening, is that where this money came from? Did we talk about that?
I did not.
So this is money from various lawsuits against the opioid industry. It's called the pharmaceutical industry for, that produce opioids. There were numerous lawsuits. We were a party to some of them, and that's where this money came from. So it is, as far as we know, it's one time, and it's not from taxpayers, and there were certain restrictions on it, and we feel like we're using it exactly like it was meant to be used. How does that sound? Randy?
Will this be in some type of release that goes to the public as well? Who got the awards and how much and those types of things? Or?
I assume so. Oh, Zoe, go ahead.
That's something that is in progress. Once the final recommendations are put forth, I've been working with Dominic to put together a press release announcement for the community.
Thank you.
That'll happen, assuming we pass it in just a minute. Then it'll go to the full legislature in, 2 more weeks, and then it'll be official. Any other discussion? All right, let's have a vote then. Amanda?
Yes.
Randy?
Yes.
Susan?
Yes.
Travis?
He doesn't vote.
Well, he has to say recuse, I think. No?
Oh,
I don't know.
Abstain.
Abstain, yeah. Sorry. Yes. Gotcha. Travis abstains, and I'm a yes. So that is 4 to 0 to 1. And that passes. Congratulations, everybody. One more time, thank you for everyone that's put a lot into this. All right, we are going to keep, Brenda, is there anything else from Whole Health that you'd like to talk about? I'm sorry, you're muted.
No, I don't think so. I think we're good for right now.
Okay, well, thank you so much.
Thank you.
All right, next up then, we did youth services already, our departmental updates. And we already had quite a few of them. Let's see, we have Ken Clark, Office of Human Rights. Hello, Ken.
Good afternoon. Just a real brief report of this. only have one item to report that on August the 6th, we had a great Democracy Fest event that was organized by the Civic Engagement Coalition that OHR and the Human Rights Commission helped to organize about a year ago. The Democracy Fest event was held at Southside Community Center, and we had about 100 people participate in this event, which was a mix, provided a mix of music and speakers and spoken word. Our speakers included Senator Leah Webb and City Alderperson Phoebe Brown, among others, including yours truly. And it was a very successful event, and a lot of that success due to the participation and work of coalition members, but also to a number of agencies, which included the County Board of Elections, which participated. Steve DeWitt was one of the speakers, and both Steve and Alana Congdon were present at the ready to register voters, persons who had not registered to vote. And a number of organizations helped to contribute to making this event a great success. We want to build on in the future as well. And we're also appreciative of the work of our facility staff, which picked up and returned sawhorses to the City Department of Public Works, which we used to block off Cleveland Avenue for the event. And so it turned out to be a really wonderful event on a great day, which also happened to be the date of the 58th anniversary of the signing of the Voting Rights Act, which is an important part of civic engagement. So that went very well, and it never hurts to have Ben & Jerry's ice cream to serve at such events. So that's my report.
Can I add that not only did they have Ben & Jerry's ice cream, but they had one dairy-free flavor, so I was quite surprised and pleased. Any questions or comments for Ken? All right. Well, thank you so much, Ken.
You're welcome.
Next up, we have Lisa Monroe, County Office for the Aging.
Hi there.
Hello, Lisa.
Hi. I really don't have anything to report. We're just doing our usual. Nothing out of the ordinary, doing lots of outreach events this summer, and still distributing our farmers market coupons. I think we're up to about 500 or more that we've distributed, so that's a good thing. But other than that, just status quo.
Okay, thank you, Lisa. Any questions or comments for the County Office for the Aging? All right, thank you.
Thank you.
I think that's all the departments. Did I miss anybody? Let's see. I know that Cindy Wilcox from Human Services Coalition told me she couldn't be here today. So I guess that's everybody. All right. We have minutes approval from July 17th. Is there anybody that wants to move the minutes? Susan moves the minutes. Is there a second? Amanda seconds. Thank you. Discussion about the minutes.
Yeah, speaking of Cindy Wilcox, in the attendance list, under Cindy's name, it just says Executive Director. I think maybe it should say of what?
Human Services Coalition. Good.
For posterity.
And to catch on all these details.
I know, sorry.
Oh, not sorry. That's good. Okay, any other discussion about the minutes? Okay, let's have a vote then. Travis?
Yes.
Randy? Susan?
Yes.
Amanda? Yes. And I'm a yes. That's unanimous. Thank you. Comments from committee members, liaison assignment reports. Randy?
Yeah, a while back, we talked about SNAP a little bit, and I know we kind of put that discussion on hold. And this is really a question for Lisa, I think. Is it possible for me to be schooled on how SNAP works by somebody? I mean, just I'm not sure how that would work, but I'd like to just show me how it works and how the process goes. I did speak to Sarah from the food bank, and the app that they have now on their phone is approved by New York State. And she tried to get me to use it, but I said I don't want to do that yet. But I just wanted to say I'm interested in that, and if I could sit with somebody to show me that process, I'd appreciate it.
Sure, I can speak with Kit from Department of Social Services. And my understanding from Kit, the last time we convened and were talking about this, there was, they were in dire need of social welfare examiners. And they, I believe now are just about full in terms of their recruiting and bringing people on. And she had mentioned that the efforts, I think you and perhaps others were spreading the word that helped. So she wanted to thank you for that. But I can speak to her about going through with you, either herself or a staff person, to explain the program.
And I realize that they're catching up, so it doesn't have to be tomorrow. So
sure,
sometime in September maybe, or later.
Sure.
So yeah.
Thanks.
Thank you. Any other comments from committee members? I have a couple of last things I want to say before we adjourn. First of all, I know you didn't prepare for this, Emily, but we have Emily Parker in the audience. Do you feel like saying anything to us today? You can have a seat at one of the desks if you want. And just, you should be approximately 6 inches from the microphone.
Thank you. Thank you very much for the opportunity to be part of this meeting. And I want to add my thanks to the Opioid Task Force and all the incredible work that was done, very thoughtful, very responsible and inclusive, to come up with your decisions and make your recommendations. Again, Emily Parker from the Alcohol and Drug Council. I know the legislature is familiar with the work we've been doing to develop our Open Access Detox and Stabilization Center. And the legislature has been very supportive of this, and we really appreciate that. And this funding, you know, we've spent a lot of years working on this program collaboratively with innumerable community partners. And our request for a vehicle through this funding was based on a need that many community members, legislators, expressed, that access to treatment, timely access to treatment, was a deficit in our community resources. So we're very grateful for all that's been done from the state and county to support this project, and we're very grateful to have the opportunity to include a vehicle in our resources. So thanks so much.
I know there was an article in local media recently, maybe you wrote it, I'm not sure, and described it. It said that some of your programs were up and running, but not all of them yet. Is that basically how it is right now?
Yes, absolutely. It's no secret that there's a shortage in nursing, but we have not let that stop us. We've opened our stabilization program, which is less medically intensive. And that's actually a longer, I would say, meatier program. You know, people can come in mild withdrawal. Stays are typically 2 weeks to 2 months for folks. So in that interim, they get medical care, they get medication-assisted treatment, they get individual and group counseling, they get a lot of programming to help them deal with triggers of their addiction, to prepare them for employment, housing, child care, putting together the systems that they'll need to be successful in recovery post-treatment. So that's going well. We're ramping up, you know, taking on a couple more people each week as our staff gets ready to go for that. So that's been a wonderful start, and we're encouraged, still working on the rest of our hiring so that the full vision of open access, 24 hours detox and stabilization, will be available to our community soon.
Well, good news. Questions or comments for Emily? You are welcome to come back here anytime. Give us just a little bit of advance notice. We'll get you in, and we'd love to keep hearing about how things are going there.
Great. Thank you so much.
Thank you. All right, and speaking of presentations and visitors, we were originally supposed to have a childcare presentation at this meeting, and that presenter wasn't able to come, so hopefully we'll get that scheduled somewhere further down the line. Our next meeting is on September 18th, and we do have two things scheduled right now. We have Marty Stallone, the CEO of Cayuga Health Systems, that's coming back. He came in maybe February, March, something like that. I thought that was one of the best meetings. I loved that, and I'm really looking forward to having him back here. I know I've asked him that we want to know a little bit about the Crisis Stabilization Center and the status of that. And I also asked him if he could just educate us a little bit on mental health services at the hospital. It's something that they provide, but I truly don't know much about it at all. And I think it would be, it's a piece of the puzzle of how we approach that issue in this county. And so I think it would be good for us to learn a little more about that. But he'll be here for sort of that and kind of an open-ended discussion. So if there are other items that you would like him to address, it probably would be good to let him know in advance, just so he has time to prepare a little bit or get the right person to come here with him. Also at that next meeting on September 18th is Whole Health. We'll be doing a little, I'm not sure if it's a full-fledged presentation, but I heard a little bit about some collaborations that they're doing with Cornell and with Cayuga Health Systems, and it sounded really interesting and creative and a little out of the box, a little something we haven't heard much about. So I've invited Frank Krupa to come and educate us on that. I think it'll be really interesting. So that was all I had for today. Is there any other business before this committee? All right. Well, thank you, Taylor. Thank you, Jordan. Thank you, Rob. Is there anybody else I need to thank? But thanks, everybody. And we are adjourned.